I'm Dr. Hlatshwayo-Davis, Director of Health for the City of St. Louis. What I think is being missed in the conversation are tangible stories, tangible programs that affect the public every day. What I also think is a misstep is that people think about these programs, contracts, whatever you may call them, as their title and their title alone. So for example, last week I got the first 4 major cuts to 4 grants, one for COVID, one for adult vaccinations, and one that is sort of a health disparities one. The COVID one, you would think, COVID, the pandemic's over, it's endemic now, we're not even seeing really high cases, respiratory season is over. Obviously, that would be a clear area to save money. However, public health is more than disease. Public health is about how empowering you to be able to thrive in every way. And so we set up a food program with the YMCA through our COVID grant that was cut. We were told that that grant was cut that day. The language was effective midnight tonight, you cannot do anything programmatic with this grant, and effective 3 business days from now, you cannot do any invoicing. What that meant was for this particular food program that we had established with the YMCA, we do nutrition classes. Folks can come to free to the YMCA and figure out better ways to build a diet, to grow their own plants, how to cook their food in a healthy way. But we're also empowered to feed kids, quite literally. If they come to the YMCA for these programs, they get food in real time. So we were able to subcontract, contract, partner with, and build foundational programs through COVID grant funding for things like a food program. Another program, right, is we were able to advocate for funds for data for our epidemiologists. In order for us to report to you if influenza is at a low level, moderate level, or high level, in order for us to do surveillance and case investigation, that is the work of data analysts and epidemiologists. To only have 2 for the city because of that deprioritization of public health, inheriting less than 1% of the city's budget, when the WHO says any city in any country across the world should dedicate at least 5% of the city's budget. There are African countries who invest more in health and public health than we do here in most cities in America, okay? Fact check that. I don't play. All of these talking points that the Republicans have right now around efficiency, I believe in that. If you want to know who has to lead with efficiency, it's a public health director. To have less than 1% of the city's budget, but to have to liaise with all the public health with all the schools in the city, to be able to bring foundational public health programs with no money, my whole job is figuring out how to meet the needs of the city with food inspectors, with water, with people who are testing your swimming pool water, who are going to your restaurants and making sure that there aren't rats running around while you're sitting at a table, right? With less than 1% of the city's budget, all I do is efficiency. All I do is figure out the best ways to be efficient. Everyone knows the YMCA is a cornerstone of any neighborhood, especially in the poorest neighborhood. That's a safe space for poor families who have to work long hours to have aftercare programs. We knew that partnering with YMCAs, just like we partner with libraries, quite frankly, we have Narcan boxes and Narcan programs in partnership with libraries because we know the cornerstones, rec centers, YMCAs, and libraries, right? Churches. These are the foundations of accessible public health. So we've partnered with YMCAs to bring nutrition to kids. So kids come from public schools. Most of them have to walk, take a bus, you know what I mean, after school to be safe with these incredible, I think, educators and experts at the YMCA. And then we partner with them to bring public health experts into that space with the kids and talk to them about healthy food, talk to them about, you know, sugar is not just as simple as cutting a pack of sugar that you have, but even the kinds of fruits you eat and the kinds of vegetables. We talk about obesity in that space. We talk about ways that they can grow and have neighborhood gardens that we've developed. We have urban gardens that we partner with in poor neighborhoods in St. Louis so that people can have fresh food. Fresh food is really expensive. If you go to Schnucks, Whole Foods, or whatever, if you commit to a fresh food lifestyle, it's not cheap. So we partner with the YMCA to make sure that they have linkage to that food. And these are kids as young as kindergarten and first grade through middle school. Seeing the word COVID and immediately cutting off a grant without even doing the due diligence to look at what kind of programs would be affected underneath that. I would be fine if you said, we took a deeper dive. We really took some time before we did this federal cut to look at all of the types of programs that were encompassed under those COVID funding. as opposed to just being triggered by one word, COVID. And you said, okay, we're going to eliminate treating funds, we're going to eliminate testings, we're going to eliminate all this other stuff. But if you saw a program that was providing food to poor neighborhoods in St. Louis, my God, why would you want to cut that? Secretary Kennedy, I care about what you care about. I care about making America healthy again. I just don't understand right now how these fast and seemingly rash cuts help us get there. We want to partner with you. We want to partner with you to analyze, to look at the data, to make responsible cuts. We want to be more efficient. Quite frankly, we are in the business of being more efficient. Right now, harm is being done, and harm that will affect the most vulnerable amongst us. Our children, our elderly, the immunocompromised, folks in the poorest of neighborhoods around us. And for those who have become comfortable with the idea that as long as they shut themselves off and protect their personal interests, the next message I would have for you is that diseases have no boundaries. If they affect one community, they will spread to others. And so we have to focus on these groups, whether we want to eliminate certain terms, whether we want to eliminate certain practices, because what affects one group in any city, in any community, in any neighborhood affects everybody else. Please stop these fast cuts that have not had the time to be analyzed, to see where good is being done and where harm is being done. We care about people with chronic diseases. We care about people not having cancer. We care about not putting chemicals into people's bodies and making them sick. I care about those things. I have 2 children myself, and I fight for their health every day. But what is happening now is doing more harm than good, and that harm may not be able to be undone quickly if you do not act now.